Hi, and welcome to A Better Place. As you know, December 1st is known as World AIDS Day. And today on A Better Place, we will be bringing you a special edition on HIV/AIDS awareness. Stay tuned, we will be right back. Welcome back to A Better Place. As I mentioned earlier, we will be having a special edition today, and we will be speaking today to our guest, Dr. Vanosh, who is the president of the St. Martin AIDS Foundation. Dr. Vanosh, welcome to A Better Place.
Thank you very much, Angelique.
Dr. Vanosh, let's get right into this interview. Can you explain to us how you got involved with the St. Martin AIDS Foundation?
Before I came to St. Martin, I came to St. Martin in '89. I did some short projects in Africa where I was basically first confronted with people living with HIV at that time because, I was working in a war zone, so we couldn't really do much on chronic diseases at that point, but we did notice that when I was treating people with tuberculosis, some of them did not respond to the treatment, and we had to assume that they had AIDS, because tuberculosis and AIDS are very much related to each other, and in many countries like Haiti and in Africa, tuberculosis is one of the what we call opportunistic infections, the infections that happen when your immune system gets very weak. On St. Martin we don't see much tuberculosis, but in other countries they do. So when I came to St. Martin, and I had just finished also my studies in Holland, I noticed that much more than what I had noticed in Holland, there were people living with HIV here on the island already and in the clinic where I started working. So it took my interest, and very quickly in 1990 already I founded the St. Martin AIDS Foundation to work with a local team on prevention at that time, especially because there was no real treatment available at that point, and at least to give people living with HIV at that point kind of a humane way of going through their last 1 or 2 years, because at that time survival with AIDS, once you had the diagnosis with the disease, 2.5 years was the maximum survival, you could say, and that has completely changed over the years. AIDS and HIV infection is now a manageable chronic disease with the medicines we have available also here on St. Martin. You could really keep the virus completely under control. You cannot cure it, you cannot kill the virus, but you completely slow down the production of new virus in a person that is taking the treatment, and with that their immune system is able to recuperate, strengthen again, and they can actually live a complete normal life also as far as lifespan, duration of life, because they did some research on that, and people living with HIV diagnosed early, and that's the trick. You need to be diagnosed early. We'll talk probably a little bit more about the testing later on, and you start treatment early and properly take that all through your life, then you could pretty much have a complete normal lifespan and a healthy life, productive life, even living with HIV.
Okay, wow. So actually your foundation has been in existence for 21 years already.
That's correct, long time.
Wow, that's a long time.
Yep.
And how do you get young people involved, to bring about the awareness and also involved in your foundation?
Young people, I must say, are always a joy to work with, and we have a number of young people, both locally that assist us. We have also students from the medical school assisting us, obviously also young people, but both on island and from the medical school we have people really supporting us. It is, however, difficult, we noticed, to get committed long-term volunteers, because many people here that are volunteering are already busy in 2, 3, 4 different organizations and kind of spreading themselves thin. So to get people to really commit with us for longer periods of time has been quite a challenge. Also, of course, with young people, they're students. That means there's a turnover because they start working with us for a short while, and then after 2, 3 years they go for studies abroad, and then we lose them. But it also means that on a continuous basis we have new people coming in, we train them, we give them the information to help us. and it brings in a little new blood on a continuous basis as well.
Yeah, the reason why I asked about youngsters, because we know that when you're young, you don't really take life too serious, and
Correct.
you don't heed the warnings that you get from your elders.
Absolutely.
So what about the schools, and how do you bring about awareness throughout the schools?
We've had Girl Power. Many people have heard from our Girl Power program. It's a program that started off from a study we did in 2003 among our secondary school children with Emory University of the United States, and that developed a locally made program, Girl Power. That's a program geared towards young women 13 to 18 years old in secondary schools. It's an after-school program where in a 3-day after-school program young women are confronted with issues of life, assisted in increasing, strengthening their self-esteem, making healthy life choices, and obviously a large part is also awareness and prevention of sexually transmitted infections, including HIV. The boys, the young men, have been left out because we didn't have the financial resources at that point, neither a good program for them to work with, but more and more the girls indicate to us, like, we want you to work with the young men as well, with the boys as well, because we know now what to do, but we still get these questions and responses from young men, from the boys, so we would like you to work with them as well. The boys also felt left out because we were doing something with the girls and they wanted some program as well. We did a recent CUP study with Emory University, again together with the Ministry of Health and the Ministry of Education. A CUP study is a study among the secondary school children and out-of-school children, which stands for CUP, is knowledge, attitudes, behavior and perceptions. And that is not only about HIV. This was a study about their curriculum, about how they use networks and ICT and Facebook and their BB phones, etc., in getting messages among themselves up and running, about healthy eating, about smoking, drug use. So it had a large scope of different questions. The results of that study will come out in December, and with the results of that study we will develop with Emory University again a program for the boys, Real Talk.
Wow.
And hopefully before this school year's ending we will already have that program piloted in the schools. If we won't reach in time, then at least in the very beginning of the next school year, because next school year we really want to roll out that boys program as well.
And will that program also cater to teenage boys, so 13 to 19 year olds?
Same age group. But then since there's unfortunately a lot of dropouts, more among boys than among girls, I mean both of them of course, it will not only be for in-school youth, but also for the out-of-school youth. Apart from that, we've noticed that we do the Girl Power program, and we will do the Real Talk program for the boys in the first and second grades of secondary school. We've tried already to expand to primary school, but simply we don't have enough human resources, manpower, human power to do that right now yet, but we plan to do a booster program, in other words a one-day program for the girls and the boys in probably the 3rd or the 4th grade, so before they go off to study elsewhere. We also had a very active junior AIDS committee up and running for a number of years, but that was in the early 2000, and after some of the women and boys who ran that junior AIDS committee left the island for studies, that kind of calmed down. But we're definitely intending this coming year to revive the junior AIDS committee as well, because peer education is an extremely important way of getting the message out among themselves. I mean, if they listen to older folks, they think like, well, that's old-fashioned. But training young people to educate their peers, and we know that peer education, or peer pressure actually, is really part of what's going on among the youth. We think that's an important way of getting the message out to them.
Okay, good. Dr. Van Osch, thanks for all of that information so far. When we come back, we will be discussing further on preventative methods and more about HIV/AIDS. Stay tuned, we will be right back.
Man, I'm supposed to take my girl out to dinner this weekend. She's so broke, man.
Man, I used to have those same problems, but since I got my whip company card, when I take my lady out, I even get something back. listen.
But you're a lucky fella.
I take your mind out the gutter, man. What I mean is, with Whip Compaleon, I get back 1% on every purchase I make. With this card, I can spend in guilders and use it throughout the Netherlands and Tilly's. Instead of paying 1% at the dollar credit card, now I get 1% back on every purchase I make at the end of the year.
What? I gotta get myself a company on card.
Man, but let's go.
Let me go.
Man, now my lady's birthday gonna be a real celebration. At least now with Whip Compaleon, I know you're gonna get something back.
The Web Compaleon credit card with limits as low as 500 guilders. You don't have to walk with cash and it is accepted by practically all businesses. The Web Compaleon is the first guilder credit card that can be afforded by anyone.
GEBE has been faithfully serving the communities of St. Martin, Saba, and Statia, powering your home and our economy. Come rain or shine, our qualified team of professionals are working hard 24 hours a day to provide you and your family with safe, reliable electricity and water. We use the latest technologies and test our products daily to maintain the highest international standards. Our friendly staff is always there to assist you, whether in person, over the phone, or online. We are committed to constantly improving our products and services, making them more efficient, effective, and environmentally friendly to serve you better today and our next generation of clients tomorrow. GEBE, powering a brighter future.
Welcome back to A Better Place. So, Dr. Vanosh, can you tell us exactly what the AIDS Foundation does here on St. Martin?
Sure. The AIDS Foundation is a non-governmental organization. It's a non-profit organization. Up till now, it's always worked with only volunteers. We started off in the early 90s with only awareness and prevention activities, although we were already giving support to people living with HIV and AIDS. There was no treatment available at that point, but counseling, information to people living with HIV and their families. And then, of course, a lot of awareness and education activities, both for the general public, for the youth, for men having sex with men, for the Haitian community, the Spanish-speaking community. We always try to work with those communities as well. And over the years, we've evolved quite a bit. And presently, some of the activities we do is we give assistance, and that is care and treatment and counseling to anyone living with HIV who needs information and assistance. Care and treatment free of charge for the uninsured people living with HIV and AIDS. We have HOPE, the Helping Ourselves in a Positive Environment support group for people living with HIV and AIDS, up and running. Then we have the Girl Power Project we spoke about, the Boys Project, the Real Talk Boys program we're going to start up soon. We have our regular test days, the free rapid HIV test days, which we'll probably talk a little bit about when we talk about World AIDS Day. We have an education program up and running in the brothels, and we're going to expand that coming year, not only in the brothels, but we'll try to also go to the bars, clubs where, well, sex is being offered, although it's not necessarily, it's more the informal clubs, you could say. We've been always very busy trying to get the prices down for the antiretroviral medications, the HIV medicines, because they're still very expensive on our island. And by getting the prices down, it would help us to make it cheaper to help our uninsured people living with HIV, but also work with insurance companies to make them more aware about the fact that the private insurance companies especially, that they should cover HIV treatment, care and treatment. We're working with insurance companies to see in how far they could change their mindset. I mean, still insurance companies are very often thinking this is an incurable disease, long-term, and eventually a high